Hey there guys, back with Action Potential. Continuing the conversation about neck stiffness and headaches. A lot of the times we're dealing with patients or athletes that either deal with a solid part of their day being in a kind of extended forward, flex forward, tight neck. I'm on the computer or I'm driving or I'm having to look up if I'm doing some sort of construction job or something like that. Basically, all the muscles in the top part of the head in this occipital region get super tight, and the issue with that is we have nerves that basically travel in between the muscles that kind of jump through there, and when those muscles are tight, they basically get a stranglehold on those nerves, and that's where we can have the headaches like our coat hanger headaches that kind of shoot up over the top of our head or maybe come into the eye. So what we like to give for that is a simple exercise called a chin retraction series, okay? Starting off with the generic chin retraction, what we want to do is we want to be sitting up nice and tall. I don't want to be in my slouched position. As you can see, when I go into that slouched position, I'm already closing down that kind of space in the back of the head, and we're already cinching down on those nerves, so we don't want to train that into our bodies. So I'm sitting nice and tall, thinking about taking the top of my head, pushing it up towards the ceiling. What I'm going to do is I'm going to pull my chin backwards, almost like I'm imagining my head is a train on rail cars, okay? We're not rotating, we're not tilting. I am just rolling that cart back and letting it glide forward. Roll it back, glide forward. I don't need to think about going forward, because realistically we get that all day anyways, right? That's the thing that's causing all of these issues. So what we want to do, again, from neutral, nice and tall, I roll back and I relax. Back and relax. Of course, you don't need to use the hands, but that's just a little bit of a better visual for you. Now, that's the simplistic way to do it. Chin retractions, nice and neutral. I usually recommend, if people have headaches, hitting about 10 of those every hour or so. That's really gonna get the joints moving. That's really gonna get that soft tissue to relax and allow for that full range of motion. We never wanna be going through pain. Maybe we go up to just about that sensation change, but we never touch pain or go past it. So even if that's a very small motion or a very big motion that we're hitting, again, it should never be painful. Now, once we've kind of worked through that and maybe we no longer are having headaches, but we still want to keep our neck nice and loose, what we can do is we can incorporate other ranges of motions with that. So I can, again, sit nice and tall, do my normal chin retraction. Holding that, I go, what happens if I rotate? What happens if I tilt from side to side? You're gonna get a much different stretch than normally when I'm just relaxing and I turn my head versus retracting. Whoa, I feel a little bit more tightness in maybe my SCM or my scalenes. I tilt away, whoa, instead of me being relaxed and tilting, if I retract and tilt, whoa, I can really feel this posterior scaling, that upper trap, that levator. Those things are really jumping out at me, and so it kind of shows, okay, there may be some spots in the system that we can kind of liberate, open up with maybe some other activities, whether that's mobility drills, strengthening exercises, all the kind of stuff that we talk about here on this channel. But I really love those exercises for non-symptomatic people that aren't necessarily in pain, but they feel maybe a little stiff. When we're talking about all the extra motions, right? What I usually recommend is, from that chin retraction position, it's 5 in each direction. So maybe I go 1, 2, 3, so on in all the different directions. Just starting to get that neck to move, slide, roll, and glide in all the appropriate positions so that we have our full capacity of movement possibilities, so that I can kind of look up and over. I can do everything that I want to do because I've stretched these joints in all the different ranges instead of just having everything kind of crunched forward, loosening up the back of the head. Great exercise to play around with. Again, let us know how these are working out for you. Let us know if there are any variations that you would love to see, things that are working, not working. The more information you give to us, the more that we can give back to you. Take 2.